Pedro Martinez is at the NIH, where he works with children and adolescents. And I'm going to leave it to you to introduce yourself in a bit more detail.
Thank you.
Thank you.
I, first of all, I'm very grateful to be here today and be able to speak to the families and the individuals with, who are dealing with a chronic condition. This is the kind of work that I've been doing, I guess, for the last 20 years in my role as a psychiatrist at the NIH. And I'm not only involved with dealing with conditions that are rare, but also chronic conditions that affect children and adolescents and affect their lives. And I guess that's one of the reasons why we're all here and talking about this. And I like to take I like to leave some time for questions at the end. I like this to be interactive, but I would like to go through my presentation briefly and then take some questions from the audience, if that's okay. So let's see. So one of the things that it's very common and prevalent in our society is depression and anxiety is some of the psychiatric conditions that we treat very, very frequently. For example, major depression is what is called the leading cause of disability in the United States for people ages 15 to 45. And what we call, disability is this is the kinds of conditions that take time away from the individual to be able to be functional, to be able to work, to be able to participate in their social lives and be a part of their families. Major depression affects about 16.1 million American adults, or about 6.7% of the population, in people that are 18 or older every year. So it's a very common condition. And on the other hand, anxiety disorders are even more common. And it's about 40 million adults in the United States that have deal with issues of anxiety disorders every year. In individuals with chronic rare diseases, there is an enormous amount of anxiety and depression that they deal with as part of their condition. For example, almost 70% of individuals with a rare disease report experiencing depression, and about 80% of them report experiencing anxiety as part of their condition. So what are some of the issues that are related to having a rare disease? So one of them is, as you all know, is diagnosing the disease. For those people that are lucky enough to live in a major city where there is access to good health care and to big hospitals where there's research going, usually that's not, and it takes a long time anyway, but it's a lot easier than for individuals who live away and who live in rural areas or who live abroad or who live in other parts of the world where the access to a good diagnosis or at least a good workup for these conditions is very difficult. So just as you are probably have experience, going from doctor to doctor, test to test, and having no answer for what's going on, it's a major burden. So what happens to an individual who cannot get a diagnosis? You lose hope, you lose faith, you feel like there's no answer out there for you, but you're still feeling sick. And a lot of times, one of the things that happens is that your diagnosis comes into question. I mean, people start thinking that you may be creating this is all in your head. And many of the patients that I've seen have gone through that process where they have been questioned by the medical professionals about what the origin of the real diagnosis is, because they think you might be making it up, or there may be something else going on that we're not aware of. Obviously, you know, having a chronic condition that, you know, where your, you know, let's say, for example, your immune system is compromised and you get a lot of infections and you have to go to the hospital a lot, it'll disrupt your life from early on. You don't go to school as frequently as the other individuals. Your family time is disrupted. Your parents have to spend a lot of time in the hospital. So there's a huge burden on the family and in the individual on their, you know, what is called a normal life. So when do people need a psychiatrist? And, you know, in my opinion, everybody needs a psychiatrist, but, you know, I'm biased, I guess. Yeah, so, you know, so what is a psychiatrist? I mean, and that's, you know, I many times I talk to families and people say to me that, so are you a doctor or what are you? Are you a counselor? So, you know, a psychiatrist is a physician who went to training to deal with mental illness. And mental illnesses are just as much of a medical illness as anything else. And, you know, these are conditions that you know, people don't create and people don't wish upon themselves. And, you know, there has to be an expert and somebody who can talk to them and treat them in an appropriate way. So when people come to us with a chronic rare disease, and aside from the burden of the disease and aside from all this, you know, the trouble and the anxiety of arriving at a diagnosis, sometimes people come in with previous conditions, like, you know, people may have, you know, depression, anxiety, schizophrenia, bipolar disorder. So you really need an expert on these conditions in order to be able to not only diagnose properly, but also treat properly. You know, as you know, many of the rare conditions, and, you know, and speaking in particular about data 2, you will, you know, require medications, you will require antibiotics, you will require, you know, potentially a marrow transplant. That it all complicates treatment down the road. So getting a psychiatrist involved in the medical management when there is a condition that needs to be treated, and I'm talking about a psychiatric condition, it's important to get them involved early on. So you know, when we talk about primary versus secondary psychiatric problems, is meaning that, you know, do you come with a psychiatric problem already, or do you develop a psychiatric problem because of the burden of the disease? I mean, how many times do I see kids in the inpatient unit who come to us for either a transplant or dealing with chronic infections or, you know, having to be hospitalized for a long time, that develop a depression or an anxiety while in the hospital or because of the disease. So that's what we call secondary psychiatric illness. And it's not uncommon. I mean, one of the hardest things that you know, and particularly people who are undergoing bone marrow transplantation, is one of the things that I always, so before they get a transplant, they always meet with a psychiatrist in our team to sort of preemptively, you know, say, we're here, we're available. If there's trouble, you can call us. You know, this is not an easy process. And one of the things that I always tell my patients when they come in, before they come in into a transplant situation, is to say, this is not an easy process. This is a long process. We have no idea when you're going to get out of here. And those are the things that we're going to be dealing with while you're here. And so that the patients are at least semi-prepared that they're going to be there for a long time. But doesn't, you know, but that doesn't take away the fact that they become depressed and anxious when you have to be at a hospital for months at a time. So one of the things that we always have to be aware of is that in people with chronic illnesses or rare diseases, is that a lot of organs can be affected. So we have to tailor our treatment to someone who may be having a kidney problem or a liver problem or a cardiac problem, so that we don't add on to the problems that these individuals are having. They also come in with a ton of medications. And if we add medications into the regime that are going to be interfering with all the other medications that they have, or may potentially increase the side effects of those medications, or increase their half-life, meaning that these medications will go up, their levels will go higher, or will compete with those other medications. So if we don't know what we're, the biochemistry of these medications, then we could be adding on to the problem again. As I mentioned already, I already talked about the people who are undergoing a bone marrow transplant, and when individuals are going through the bone marrow transplantation, usually they go on to immune suppressants, corticosteroids, all kinds of medications that will affect their immune system. So one of the things that we have to be mindful of is what are the medications that we use to treat anxiety and depression that could affect the bone marrow production. So we don't add on to the problem, and we don't add on to the potential complications. Same deal with antibiotics or all the other medications that are used. So that's what the role of the psychiatrist is someone who comes in and helps the medical team figure out what is the best treatment for someone who is suffering from anxiety or depression during their treatment. So why do we want to treat these conditions? From multiple studies, not just from chronic illness, so rare diseases, but many studies have shown that having a major depression or a depression along with a medical illness can shorten your half-life. For example, the individuals who have suffered a heart attack, who are in the ICU, who have a depression have a 50% mortality increase just because of having a major depression associated with it. So treating the condition becomes very important in the survival of the patient. When we treat these conditions, we always, as I mentioned, have to be very careful with the kinds of medications that we use. We know that our medications, like any medications, can be toxic. And one of the even antibiotics, aspirin, anything, that we introduce into the body can have toxic effects in certain individuals. And we always have to consider each individual personally and their history in order to be able to medicate. There can be, some of the medications that we use can cause cardiac problems. So we need to know, for example, that these individuals' heart is fine, so that we make sure that we select the medications that are not going to create complications. As I mentioned before, we don't want to use anything that suppresses the bone marrow, well, especially while people are, who already have immunological problems, to put them even at higher risk for secondary infections. Liver problems, kidney problems, all those things have an effect on how do we use, what medications we select. The other thing is that we have to consider is how do we give these medications? Some of the patients that we see, especially post-transplant, when they're having complications, can't have anything by mouth. They even have side effects from some of the medications that they take, or is it a side effect from the actual transplant? Because there's an initial reaction that that sometimes individuals go when they receive cells from another human being that are expected and that are normal, but that could affect their ability to eat or to drink anything by mouth. So we have to always be mindful of how do we administer these medications. And the other question is how long, and this is a very frequent question that I get from family members when I do treat individuals with either anxiety or depression, is how long does my family member or my child or I have to take this medication for? And one of the things that is affected by either depression or anxiety is compliance with the medications that, not just psychiatric medications, but in general, medications that they're taking for their own condition. So if we don't treat these conditions, people have a higher rate of not taking the medications that they need for their medical treatment. So we have to be mindful of that. But one of the things that happens with individuals that are taking psychiatric medications is that they don't want to take them for a long time. I'm the first one that I tell people, I don't want to give you this for the rest of your life if I can, but if it's something that is going to allow you to have a better quality of life, then we're going to have to consider that maybe you're going to need this medication for a longer time than we have wanted to. But many times, if, for example, in situations where the condition is created by the illness itself and it's a temporary condition, then we can treat people for a shorter time. But it is hard to say when we're going to be able to take people on or off of medications. But as always, this is one of the things that you need to be very involved with your psychiatrist or the person who's treating you in order to be able to determine how long do you continue to treat the conditions. Sometimes, we are in the position that we also have to use medications to treat delirium or psychosis that are maybe associated with some of the side effects of the medications, or we have to, sometimes people have hallucinations from the medications that they're taking or from the transplant process. So again, these are situations where you need a psychiatrist to come and help because of all the other potential complications that may happen in terms of the rest of the medical treatment that people are undergoing. Anxiety is medications for anxiety. One of the things that I try to stress in my approach to treating anxiety at the hospital is that. And by the way, usually the anxiety that I'm treating is from the nurses and the doctors that are at the hospital. As soon as a patient starts feeling, like if a patient who's been in the hospital for a while starts crying, call the psychiatrist. Let's see what's wrong with these people. When you are an inpatient in a hospital where you're in isolation, you can't get out of the room, you cannot leave your room, you cannot eat, you're frustrated, and you have a moment of sadness or a moment of frustration, are you not supposed to have that, according to the rest of the medical team? So they always call the psychiatrist for that. So I would say that about 65% of my consults are usually just calming down the medical team and saying, this is okay, this is normal. People have put yourself in their shoes and see for a moment how would you tolerate being in a hospital for so long and everybody coming in every day and prodding and you can't sleep and taking your blood pressure at 5 o'clock in the morning, etc. So those are the things that I always have to re-educate the medical staff so that we don't medicate unnecessarily or treat people unnecessarily or label them unnecessarily. So treating conditions of anxiety with, usually we treat people with benzodiazepines, like Ativan, Xanax, lorazepam, things like that in order to treat brief episodes of anxiety. Long-term, we rather use some antidepressant medications that work well with anxiety disorders. But overall, anxiety disorders are better treated with behavioral approaches. They are better treated long-term with increasing the individual's ability to cope better with what's going on and the frustrations that are going on and being able to overcome those frustrations and those issues and those difficulties. That is the key to treating anxiety long-term. And I think that you're going to speak about that later on. So to me, the role of psychotherapy, not only to treat anxiety, but in general, in order to cope with chronic illnesses, is an important tool that should never be dismissed. And I think it should be the first tool that people should approach when they're dealing with a chronic illness. To me, that's crucial. So how do we help? We help with the medication management. Many times I have patients that are arguing with their practitioners to deal with, I don't want to take this medication. I'd rather take this other medication that I read on Google that's much better for this than what you're giving me. And I get called all the time about, from physicians that are telling me, can you deal with this patient? You know, they're not following with my regime. So those are some of the things that we tend to do. We also make sure that, you know, if there's a change in people's behaviors or mood, that we can assess that quickly and then make sure that what's causing that. We also help the families, you know, understand what's going on and sort of normalizing what's going on and helping them cope with the long and arduous road of going through having a rare disease and having a chronic illness. It takes a toll on everybody. And also, as I mentioned before, helping the medical team how to communicate better with the patients, how to communicate better with the families, how to communicate better with each other. I can give you countless stories about the difficulties that people have in a hospital with communication, and it can be a crucial point. And you know, usually we come in and we sort of put everybody together and sort of figure out things in a better way. So, you know, psychiatrists are not just there to deal with the medication and with, you know, with the you know, people when they're having depression or anxiety. We do a lot more than that, but also we also look forward to you know, helping the medical team and helping people understand what's going on with the individual who's undergoing all these treatments. I think that's it for me, and I'd like to leave some time for you to ask some questions if you have any.
Any questions?
Good.
Oh, here's one.
Bueno, hola a todos. Bueno, my English
hi,
is
everybody.
so bad. I ask in Spanish, and you can translate.
Okay.
Bueno, tuvimos el privilegio de tener al doctor Martínez como
we had the privilege of having Dr.
médico
Martinez as a
psiquiatra
physician, as a psychiatrist,
durante el proceso de trasplante de Gabriel.
and during the transplant of Gabriel's transplant.
Y puedo decir que lo más curativo o lo que mejor hizo él fue manejar nuestra ansiedad.
And I can tell you that the best thing he did was to manage all of our anxieties,
Porque creo que es en lo que somos mejores es en la ansiedad.
because we're good at it, and we're good at anxiety.
Así que bueno, el doctor tuvo mucho trabajo con eso.
So he had to work hard for that.
Y lo mejor que nos pudo dar es sentirnos escuchados, sentir que nos comprendía, que nos escuchaba y que le podíamos transmitir nuestros temores y que él nos iba a entender.
The best thing we got from him was the chance to be listened to, and then be able to feel like somebody's listening and then somebody understood what we're going through.
Sí, que por ahí eso ayudó quizás más que cualquier medicación.
That probably helped better than any other medication.
Así que, bueno, la pregunta mía es,
My question is,
¿cuál sería el consejo para no cargar a los hijos de más con todas las preocupaciones que uno trae?
What's your advice for parents not to overload your children with more worries and more? That's a hard question. So, I mean, I think that, you know, having, you know, and that's where I think that psychiatry can, or, you know, psychology, and the people who are there, part of the team, part of the mental health team that works with individuals who are in a, you know, at least in a hospital setting, and even outside, is that you have a chance as a family to run through and run by questions and anxieties and concerns that you may have with those practitioners, rather than, especially when you know, and everybody knows, when tensions are rising and everybody's feeling tired and everybody's feeling exhausted, when you're losing your ability to be able to filter things better, you know, that's when you need to talk to someone, and it's always useful. I do that myself. I mean, there's many times when you know, I've been treating someone who's got a chronic illness and they're failing and something is going wrong, and you know, it's frustrating for us to watch somebody who's we followed and we treated for a long time to fail and to go through hard times. And so I myself always find someone to talk to, because it's easy. It helps a lot. Yes?
Any advice on teenagehood
Ah.
and chronic illness?
So I do a lot of research on adolescence and puberty and what changes happen and the changes that happen as kids go through puberty. Just survive it. I mean, I guess. I mean, the good thing is that if you gave your kids a good foundation, and if you were able to sort of, give them if you were their anchor from the beginning, and if they got from you a lot of love and a lot of acceptance, I know that teenage years can be very difficult, but you just have to sit around and wait for that to happen, and to go through it, and it's not easy. I have a child. I mean, not a child anymore, but she's older. But yes, yeah, we all survive. I mean, our parents survived, and they went through the same. But it's in a situation with a chronic condition, it's very hard, and I think that because your kids get pulled out of school, they get pulled out of their social lives, they no longer have the same, and I tell you, for example, the kids who go through transplant and have a successful transplant, and all of a sudden, kids that were sick for all the rest of their lives finally find themselves cured, and they say, what do I do now? They don't belong into any social circle. They, their lives are turned around, and I see young adults that are trying to rethink their lives because they're, they don't know what to do anymore. They don't qualify for anything. All of a sudden you have to find a job and become functional again. I mean, it's very difficult, but yeah, I mean, so that's an added burden. I mean, the one thing that I always tell parents, don't. Treat your children in the same way that you would treat a child without a chronic illness. That solidifies the moment you start negotiating and feeling sorry for them. And that's a mistake. Because I think that sort of makes them feel that they're weaker or not capable. I mean, I like to reinforce everybody's inner ability to recover, and because they're going to need that throughout their recovery and throughout their illness, to be strong internally, because they go through a lot, and so.
I think I just said to them, it is what it is.
Right.
We
Right.
go forward.
Right. Yes.
It was kind of related to the same. I mean, the emotional thing that you have one of them with the disease and the other
Right.
two are not.
Right.
And the tendency to how much I can let this one go
Right.
with the
Right.
same mistake. I mean, like
Right.
somebody did something wrong and how much I need to cuddle this one
Right.
and not the other one. So how much I need to, I mean, you just have it on you as you're feeling that he's passing out already for a lot.
Right.
And then I need to call his attention or put him in timeout or do this and
Right.
do that. And
Right.
like myself, I have so much the feeling like, I don't know what is the future for this kid.
Right.
And what if I overwhelming him on timeout or this and that because he's something else.
Right.
And I don't know how long I'm gonna have him with me. It's always the
Right.
question.
Right.
How the feeling I'm doing this injection and it hurts so much and I see him crying and on top of that I'm being hard on him. His brothers are getting no patient with him and
Right.
it's just overwhelming to
Right.
know
Right.
how to level the things that how much you're gonna give him
Right.
or how much you're gonna put back
Right.
on him.
Right. And I I don't have a solution for you. I mean, I know that that's very, I mean, it breaks you down, and it's very hard to deal with it. Going back, to the same issue, obviously, when someone feels sick, they may be more vulnerable to being irritable and maybe more, they might act out, or they may go back to behaving like a younger child and things like that. But treating them, as much as you can, as if they're going to live forever, or at least, until their potential, and treating them as, that they're going to be a part of your life, every day. It's important, because otherwise, getting away with things or feeling like they're being treated special because they may not be there tomorrow, I think it weakens them in some ways. But but it's I don't have a formula. I mean, that's my personal opinion. But it's hard. I've lost many kids, and it's not easy. But I'm not the one who goes home without a child. And that's tough. That's the hard part.
We have a question over here.
Yes. Okay.
診断される時と診断されていない時の、治療法とかその精神的なケアの違い。
I got that. No, I'm sorry.
So, yeah, I'm an interpreter,
Sure.
and he is diagnosed. He was diagnosed data 3 years ago. 3 years ago, and his question is that what is the difference in terms of the degree or type of anxiety or depression or some kind of worries before, like me, that 3 years ago I was not diagnosed. That for 10 years I had specific kind of conditions, but I did not know what it was.
Right.
And so, but now, after 3 years later, 3 years ago, I was diagnosed, and I still have certain anxieties, but totally different, in a way different
Right.
from the one pre-diagnosis. So from your view, what is, どういう質問は? What type of?
何がその診断されていない時に、要はティーンエイジャーを過ごしているわけで、その時の、何が違うのか、精神的ケア。
So from your experience, what type of difference you can tell anxieties, depressions before and after diagnosis? In my case, it's much better, but if you could just share with me.
Yeah, as I mentioned at the beginning, I think people come in with, maybe may come in with anxiety before, their diagnosis, and that, anxiety has some genetic component to it. So, you can have families of chronic anxiety, with chronic anxiety, but definitely the having a chronic illness brings out a special type of anxiety that can be actually increase with people's having to wait for the diagnosis, or going through the process of getting a diagnosis, going through the process of getting treated. And then again, for example, I see people who have been, who have recovered after a successful transplantation, and they're doing better. But the moment they get, a cold or some sort of other, like if they get any kind of symptom that resembles what they used to have, always worries them. Oh, am I getting back to to my disease again? So, I think that anxiety can be, very, it can change over time, and it can get better and it can get worse. But what I would recommend is that anytime you have anxiety that is interfering with your life, is that you go see someone, and that you go get treated, because you can have a better quality of life by getting treatment for it.
Okay,
Anyway.
I think this needs to be the last question.
Yes, I want to leave enough time for the person who's an expert in
Oh, hi. My younger daughter, I was saying earlier, is well, and Alia, her sister, is confirmed Dada too.
Yeah.
My worry is she's had a lot of years of anxiety just in general. I mean, I myself have MS. Alia's been very poorly. And I'm just relating to the story over there. You have to give your love to all your children.
Right. Yeah, I'm always impressed by Go ahead, I'm sorry.
I'm sorry, I'm the grandmother, and you know, well, like everyone here, when you've got one well and one unwell,
Yeah.
it's very difficult,
Yeah.
and the anxiety with the younger one, it's been extreme,
Yeah.
and we've had struggles with her with the anxiety, and it's been very, very difficult to deal with. So, you know, everyone's here is on that journey. But, so.
Sorry, my question is, I'm scared to get her tested, and I don't know if she would cope very well. I mean, I know she has a 1 in 4 chance, and I think she knows she has a 1 in 4 chance of being a carrier, developing this condition, etc. But do I go down that journey now with her, or I don't know what to do?
Yeah. I mean, I think that's, you know, this is one of the situations where you can I think it would be useful to get some professional help, either a psychologist or a psychiatrist to talk to in order to get there. But, you know, if you think about it, you know, the reality is that these are, you know, probably, you know, she needs to get tested, and you need to get her tested, obviously, because you could prevent so much, and you can work through that much better by knowing. I mean, I know that many times we don't want to know what's going on with us in order to just like ignore it, and, you know, it's not going to happen if I don't think about it. But, you know, when you know that the risk is high, and, you know, to not do so, it just weakens you if you don't confront it. I mean, I believe, you know, and I'm always, one of the things that I appreciate and that I'm humbled by is the families and the patient's ability to sort of be strong and to be, I mean, I've had kids that have been in the hospital without leaving the hospital for a year, you know, being unable to get out of a room, being unable to go home for a year, and they keep fighting, and they keep, you know, I mean, and so I am always impressed by the capacity of a human being to be able to survive and to surpass a lot of these frustrations and anxieties. I think that the moment you head it on, and the moment you face it, you know, directly, you know, you feel much better, and the whole family will feel much better. You do it as a team, you know, you do it as a group, and you do it, you get everybody's support, and that's what you're there for. That's what families are there for, and there's nothing better than that. Okay.
Okay.
Thank you so
Thank you
much,
so
and
much
I
for being
appreciate
here.
your time.